The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to today's webinar. It's Oral Health, the window to your overall health with Delta Dental of Idaho. I'm Isabel Carita. I'm the Employee Wellness Coordinator for the Boise School District. And just a few things before I introduce our guest from Delta Dental. At the end of the webinar, you will get a quick survey. Please make sure to enter your employee ID number, and that way we can enter your points because you do get 25 WellSteps reward points for watching. If you're a retiree, make sure that you use or you enter a date of birth because it's different from our active employees. They use the employee ID number, and for retirees under the age of 65, we capture your information using a birthday. At the end of the webinar, we are giving 3 Sonicare toothbrushes away, so make sure that you stay through the webinar. So just a few things. Also, if you know of people in your building that could not attend the webinar, make sure that they understand that they can contact me and we will record the webinar and I will make it available because I know that there's a lot of PLCs happening on Wednesday. So they are available. It will be available as of tomorrow. Today we have 2 guests from Delta Dental of Idaho. Delta Dental is one of our dental insurance providers that we have. Our first guest is Joanna Raymer, and Joanna is our account executive with Delta Dental. Joanna has over 2 decades in the dental insurance industry. She is well versed on the importance of dental health, which has helped her empower and educate Idahoans on improving their dental health. Our presenter today is Heather Brown. Heather is the Oral Health Improvement Manager for Delta Dental. Heather loves sharing her passion about oral health and the relationship that oral health plays on the individual's well-being. I know that she has served as the adjunct dental, clinical dental hygiene faculty member in the School of Dental Hygiene in Boston. She was able to share her message with students at Massachusetts College of Pharmacy and Health Sciences, and she has many more credentials, but just to get started and not to delay the awesome information that she's going to share with us, I'm going to turn it over to Heather.
Thank you, Isabel. You're way too kind. So I'm so excited to be here today and to share some information with you. And as you see on your screen, the first PowerPoint, basically our title of the presentation is Oral Health, and it's a window to your overall health. Most people that I come across, well, they don't quite understand that the head is actually connected to the body. And so if we're not healthy in our mouths, our bodies are not as healthy as they could be as well. So I'm going to invite Joanna to chime in whenever she wants to. She's really up to speed on a lot of this stuff, and she actually can contribute a lot. So moving forward, let's see here. So we're going to talk about dental decay, and dental decay is actually a disease. It's the single most common chronic childhood disease that is present in a child's mouth, and it's also 100% preventable. And when I talk about a childhood disease, this is more common than childhood asthma. It's 5 times more common than childhood asthma. And in this setting, I felt it was pretty interesting to let you know that there's 55 million school hours lost to education when children have dental decay. So it's really important that we kind of understand this disease and how it does affect our bodies in nutrition, the way we speak, the way we present ourselves. So it's really, really important. A case like this, I know these slides are pretty graphic, but a case like this is a child that has something called bottle baby rot, and a baby was probably put down with milk or some type of juice and into the, the crib, and they were sucking on this bottle. And this is kind of what happens over time. And sadly, what happens is when a child is treated for this, they're put into an operating room, and it's a pretty severe treatment. So we want to just pay attention to that. And what's important, most important about this slide is that a child should be seen by the time they're 1 year of age. And most people, when I talk about this stuff, they're like really surprised that that's the case. But so make sure that you are taking the baby in by the time they're 1 year old or by the time their first tooth has erupted. That's really important. So as we talk about dental decay, which I said is a disease, it's not just for children. Adults are living longer these days. As you see, you can see some, adult teeth here, and you can see their gums. And when the gum is exposed, there's an area of the tooth root that's called dentin. And if plaque sits on this area of dentin, it's more prone to decay than just the normal enamel surface. So it's really important that as we age and we take medications, these medications can dry out our mouth. They can cause plaque, the white sticky stuff that we try to remove every day with our toothbrush, or should be trying to remove every day. It can actually cause cavities, and so we want to pay particular attention that we're taking good care of ourselves. Another reason that we get exposed roots like this is that, you know, we might be grinding our teeth, we might have poor oral hygiene, or people can be smoking, and this causes tissue to the gum as well. So, and just another fun fact is adults lose about 164 million hours of work each year due to oral health problems, and so we want to pay attention to that and make sure that that doesn't happen. So something that I want to talk about when we talk about overall health, the mouth again is connected to the body, and I talk about gum disease, and I'm sure a lot of you have heard that term, but what does it actually really mean? Is it being said in your dental office? Are you taught about it? So under the overall umbrella of gum disease, we have a term called gingivitis. I'm sure several of you have heard of that, and I'm just going to explain the word really quickly. Joanna's heard this a million times, but she's smiling at me here. So itis means inflammation, and gingiva is actually our gums or our gum tissue. Okay, so when we have itis, it's inflammation of the gum tissue. As you see in the first photo, this person has active gingivitis, and what has happened is over time, plaque has sat right there at the tooth and the gum line, and it's caused the tissue to swell up, to be, I call it looking angry. It looks raw. If you touch it, it probably bleeds. So that's gingivitis. It's inflammation of the gums. And so what happens is over time, you can go from gingivitis to healthy in about 72 hours. And that's basically just brushing and flossing and getting underneath those gums. Even if you floss when your gums are really puffy like that, they are probably going to bleed. But that's the body's way also of cleaning itself out and making sure that the bacteria is getting out from underneath there. So it's really important. If you do bleed, it's not necessarily bad. If it's continued bleeding forever, then yeah, probably something's going on. But for the most part, you can go from gingivitis to healthy. You can also go from gingivitis to something called periodontitis. That's another type of disease that falls under gum disease as the umbrella, like I said. So itis, again, is inflammation. And periodontium, the periodontium of our teeth, of our mouths, are our bone structure. That's our jaw bones that hold our teeth in. And it's also the gums. So we now have gum disease that is now affecting not just the tissue, but the bone of our teeth. And the bone is what actually holds the root of your tooth in, right? So periodontitis can be plaque induced, meaning plaque sits there, you're in a state of gingivitis for on and on and on and on, and finally you're going to get periodontitis. It's also brought on sometimes by genetics, our genes. We can be more prone to getting periodontitis than other people, but it doesn't mean that you have to get it, and it doesn't mean that you cannot control it. And we'll talk about that in a little bit. Also, it's brought on by oral hygiene or poor oral hygiene, systemic disease factors, which we'll talk about, diabetes, stroke, heart disease, stuff like that. And then behavioral risk factors, which are most likely smoking and drinking. So just because you have periodontitis does not mean it's, you know, you're going to lose all your teeth. It just means that you're aware now and that you can take better care. So that's really important. The way the process works is gum disease, like I said, can lead to tooth loss because, you know, the bone becomes weakened. It actually is removed when bacteria sits. So this first picture, we're measuring with a little probe, we're measuring the gum health, right? And you can see a little bit of bacteria on the first root. You can see that little probe kind of going into the tissue, and there's about a 4 millimeter pocket there. When you're at the dental office, you should have the dental hygienist or the dentist do something called a full mouth probing. And what that means is they take that little measuring stick that you see in this slide, and they go around 6 surfaces of your tooth, and they count. You might have heard them say, you know, 2, 2, 4, 2, 2, 6. Anything between 1 and 3 millimeters is healthy. When you start hearing 4, 5, 6, that means you might have some issues with gum disease. So that is the way that they measure gum disease. So this is early periodontitis. Obviously, you can see that little probe has gone a little bit deeper. You can see the bone is actually kind of going away and the tissue is pulling away from the tooth. And there's more bacteria right next to the root surface. Can you see that? So then we get to advanced. So advanced periodontal disease basically is the tissue is now lowered. That's when the root is exposed, like that earlier photograph. And you can see there's bone going away even more, and that probe goes down even deeper. So what's happening is the root of the tooth is losing its supporting structure, and the teeth can be loosened, and over time they can be lost. So we want to pay really particular attention to getting treatment for gum disease if we're diagnosed with it. Like I said, it's not the end all be all. If it's an awareness, and it can be treated and maintained. What happens when you have gum disease, though, when we talk about overall health, is that inflammation. So this, you can see this tissue is red, it's puffy, it's not healthy. And so when we have inflammation in our mouth, it also impacts the rest of our bodies. So that's what we have to pay particular attention to.
So Heather, when we're looking at this illustration, the best way to fight against having these issues is to go in there, clean your teeth. Flossing is key to getting into those gum lines in between the tooth and the gum structure to take away that bacteria, to take away that plaque. And when you clean your mouth, those pockets disappear. Yeah,
they can. So depending if you can have a 4 millimeter pocket. Well, let me start. That's a great statement. So the disease process actually starts in between your teeth, right? And where does floss go? Or where is it supposed to go when you do it? It's supposed to go in between your teeth. And what happens is the floss kind of goes up into the area between your teeth, and you're disrupting the bacteria that lives up there. It's dark in between your teeth. There's not much oxygen. The bacteria is like, woo, they're having a party. They're having a great time. And then you introduce floss into those, and you're upsetting the disease process. And so that's why flossing is so important. If you have a 4 or 5 millimeter pocket, you can either stay there, or you can probably reduce that pocket back to normal. When you start progressing further, you can still maintain it, but once you have a 6 millimeter pocket, you might be able to go to a 5, but the tissue will be not red, not bleeding really easily, things like that. So the tissue can be healthy, and you can kind of hold the disease process where it is. So that's a really great statement or question.
Can you improve that 4 pocket perio pocket just by cleaning?
Absolutely. Yeah. Absolutely. And why I'm so excited about what we're giving away at the end is the Sonicare toothbrush. To me, I am a dental hygienist. I've been in private practice for 20 years, and the Sonicare is the only thing that I use, and I've seen it work really, really, really well. And I mean, I've seen it work for people that have had 4 or 5 millimeter pockets, and they started to use an electric Sonicare toothbrush with flossing and taking care of their mouths, and I've seen miraculous recoveries from 4 and 5 millimeter pockets and into healthy pockets. So that's something that's really important. All right, so as we talk about oral health, how it affects our overall health. So poor oral health affects the body in many negative ways. I read somewhere there's 202 or 220 types of diseases that are impacted by an unhealthy mouth. Just the other day, I was reading something about your high blood pressure can be impacted if you don't have a healthy mouth. So we talk about unhealthiness, gum disease, that's not healthy. Tooth decay, that's a chronic disease. Tooth decay can lead to dental infections. And when we get dental infections, we have pain. And there are cases where people do die from, sadly, decay that has progressed further down the root. And look at where our teeth are located. They're pretty close to our brain. So if you get an infection that's not taken care of, sometimes it's not always a positive outcome. It's rare that does happen, but it does definitely happen. Tooth loss, as we talked about, when it affects our overall physical health, it leads to poor nutrition because we're not getting the foods that we need. We can't chew, difficulty speaking, and then poor self-image. So mental health is even impacted by poor oral health. Uncontrolled diabetes, that's a really, really big issue when it comes to oral health. When a person has diabetes, they don't heal as well. as somebody that doesn't have diabetes. So if you have active disease or in your mouth, and that's not controlled, and you're not taking care of it, and you're not brushing and flossing and getting the dental care that you need on a regular basis, you're never going to be able to control that diabetes. And so you got to make sure if you're diabetic that you have an oral health regimen that keeps you healthy. So some other risks. So, and I just want to clarify too. So diabetes does not cause periodontal disease, and periodontal disease does not cause diabetes. There's a cause, they affect each other. They impact each other. One impacts the other. So we want to just make sure that you know about that. There's increases for heart disease, stroke, rheumatoid arthritis, Alzheimer's disease, and I mentioned high blood pressure, and also problem pregnancies. Babies can be born really early and preterm labor, and it's really not good for mom or baby to go through that. So this is really important. Another disease that people get is oral cancer, and roughly 3% of all cancers are diagnosed annually in the United States. This year, approximately 5,100 or 5,200 people, 52,000 people will be diagnosed with oral cancer. Sorry about that. And then 10,000 will die from the disease. What I want to stress is when you're in a dental office, remember I talked about make sure that they do a periodontal check or a periodontal full mouth probe process. We also want to make sure that is what they should be doing standard in a dental visit, okay? They should also standardly be doing an oral cancer screening. And that means actually opening your mouth, sticking out your tongue. They take a piece of gauze, they look at your tongue, they look at the back of your throat, they feel your lymph nodes under your chin, they feel your neck, that kind of thing. So we want to make sure that that is being done in your dental appointment. When we talk about oral cancer, it's definitely more excessive in older adults, especially ones that smoke and drink. So we got to pay particular attention to our lifestyle habits. Another thing that's happening in this country, there's an increase in oral cancers in younger people due to something called the human papillomavirus. And I won't go into a whole lot of detail about it, but if you wanted some more information, I'd be happy to share that with you later.
So
Yes.
Heather, just a quick observation. The dentist is the first person that can identify these oral cancers. By the time you get to your doctor's office, that cancer could progress and provide a very bad outcome.
Absolutely.
So by going to your dentist routinely and having those oral cancer screenings, you're more apt, if you were to get oral cancer, to get that treated before it's too late.
Yeah, absolutely. So this can be diagnosed in a dental office much, much sooner than your doctor will do an oral cancer screening in the medical office, because let's face it, they really don't do that. So you're more apt to get it caught early, diagnosed early, when outcomes can be much, much better. That's a really good point, Johanna. I think I'm going to hire you to take over here. All right, so tobacco and gum disease, I just talked about it a little bit. Smokers have 6 times more gum disease. And when I talk about gum disease, I mean gingivitis and periodontal disease, remember, and bone loss than non-smokers. The heat and chemicals, obviously, they cause tissue damage. Chewing tobacco, you're putting tobacco next to the tissue in your cheek and you're letting it sit there for an hour. I'm not even sure, but it actually can affect the cell structure of your tissue. And that contributes to oral cancer, stomach cancer, and larynx cancer as well. And again, the dental office will be the first ones to notice this. Okay, so it's really important that you're getting a cancer screening done when you're in the dental office. And also, we talk about e-cigs and vaping, and there's still studies going on that it's just not good for you. There's no scientific evidence yet, but honestly, how can you heat up something that's flavored and there not be any issues? I'm not really on board with that. So quiz time. Joanna, you can answer this. Which of the following general, or Isabel too, which of the following general health problems have been linked to poor oral health? Diabetes, heart disease, problem pregnancies, or all of the above?
All of the above.
Yay! Okay, that was good. I tried to make it easy. All right, so call to action. What can you do? Number 1, visit your dentist at least once a year. At least once a year. Some people need to go more than once a year. Some people need to go twice. Some people might need to go more. So listen to your dentist, all right? And so be sure to call soon and make your appointment. Change or replace your toothbrush head. That's really important. that you change it, especially after you've been really sick. Don't let it look smushed and, like you've cleaned someone's tires with it. So make sure that you get that changed, because I've seen those. They're all splayed out and really bad. All right. And something else that Isabel's going to talk about in a minute, but there's an oral health risk assessment that you will be able to take starting October 1st. It'll be on your intranet. Is that right?
Actually, it'll be on the wellness homepage.
Oh.
So if you look at resources, under resources, you'll see Delta Dental. You can open that link as of October 1st, and it will be there.
Yeah, and you can do it in the privacy of your own home or wherever you can click in. It asks you some questions about your oral health. It's, you can be completely honest. No one is going to see this data. The only thing that Isabel will ever find out is who took it and when they took it. So no one sees your risk score. It's a really cool oral health report card, and I encourage all of you to take it just to kind of see where you're at. All right. So this is when you click on the assessment on Monday under the Delta Dental link. This is what you will see. It says Boise School District, it says Group Dental Score, and then it says Health or Oral Wellness, and you'll click on the Estimate My Dental Score tab, but there'll be more detailed instructions for you later. Yes.
The nice thing here is that you can actually print off your risk assessment, and the next time you go in to visit your dental provider, you can go through that information with them.
Yes.
And have a good discussion on that.
Absolutely. And it's a really good tool to get a conversation started between you and them. And you can say, have you done a periodontal screening on me? Have you done an oral cancer check? So it's a good conversation piece. Now, it's probably going to be a new document that your doctors haven't seen yet. But if they have any information or questions, they can actually contact me at Delta Dental of Idaho. So, isn't it time we start to acknowledge the importance of oral health? I think so. What do you think?
Absolutely.
Isabel?
I'm on board.
Okay, good. All right. Well, I thank you so much for letting me be here. Yes, and anyone have any questions?
If you do have questions, I believe, and Kelsey, you might be able to help us. You can type in some questions, and Kelsey will take just a few questions because I know that people are short on time.
Yeah, let's see if we have any questions here. Okay, so I have a couple, and we'll see if you have answers. Or the first one says, does it matter if I get a regular X-ray exam or the 3D full skull X-ray picture?
Well, honestly, without knowing what the issue is, I don't really feel comfortable answering that, because I'm not really sure what the situation is, because they both have, different purposes. So it depends on really what the doctor is looking for. Sorry.
Standard benefit does provide for a panoramic X-ray, I believe once every 5 years.
Okay. Yeah. And why they're taking it really depends on what they're trying to diagnose.
Okay, perfect. So for a regular exam, it might not be necessary, but it sounds like at least every 5 years that could be used. Let's see.
We'll take one more.
How often should I do a fluoride treatment?
Say that again. I'm sorry.
How often should they do a fluoride treatment?
That's a great question. So guess what? If this person that's asking the question takes the risk assessment, the self-risk assessment starting on Monday, and they are considered to be high risk for cavities, then they probably need more fluoride than most people. And effective fluoride every year is 3 to 4 times per year. Okay, so adult or children, it doesn't matter, but take the risk assessment and you're going to see caries actually means cavities. So you might be at high risk for cavities. And if you are, then you probably need extra fluoride. There are also really high fluoride toothpaste that your dentist office can probably sell to you. And that's something that you should look at as well. So thank you so much, everybody.
One more thing before we go, we're going to give 3 Sonicare toothbrushes away. So if your name is called, make sure to email isabel.snell@boiseschools.org with your location so I can send it to the right place. So we're going to give 3 toothbrushes away right now.
Okay, so I've randomly selected 3 people. That's James Derrick. Congrats.
James, make sure you contact me so I know where to send your toothbrush.
Yeah, make sure you reach out to Isabel if I call your name. So James Derrick, Kristen Dusky, and Debbie Hines.
Awesome.
Yay. That's cool.
Thank you, Kelsey. Thank you, everyone, for attending today's webinar. Our next webinar series will focus around emotional well-being. More information to come, but thank you to Heather and Joanna for attending today and helping us out. Thank you, Kelsey, as well.